do right now is tell people that if you have any symptoms, cough, fever, shortness of breath, you have to quarantine yourself until at least 7 days from when the symptoms started and at least 3 days since your last fever. The problem is people are, and I've heard this from several patients already, people are going to work being told they can't come back to work until they get a doctor's clearance. And because they need to work, they're then telling their friends, don't go to the doctor, they're going to say you can't work. Exactly. And so people are going to work with symptoms because they need to work. And I understand, like, they need to provide for their families, but it's just a really difficult situation.
So that sometimes we, being immigrants, even though this is scary and serious, still we are gathering, we are doing a lot of things, I think, that has not penetrated to us yet. So I think maybe I am alarming people, but I think with all the immigrant community sometimes, and I see it this couple of weeks, still we are doing things we're not supposed to be doing.
That's right. Justin speaking. I just wanted to respond on, the issue of people going to work and with the disguise of, if you go to the doctor, they're going to say you cannot work. I wanted to ask a question, are there people who are being laid off or, people fearing for their jobs that are now falling victim of either not having a job or anything like that? Because if they're there, I think we're going to post some information on the website, and if anybody falls a victim, you can actually reach out to us and see how we can see our best to help them. But I think the point is going to be we have to sort of follow what CDC is as passed on of social distancing. Because we know that in the immigrant community, we have that tendency of, congregating together and still, having that sort of communal living. This is something new to everybody. Even the doctors themselves, are actually, trying to encourage people to sort of practice the social distancing. And the reason why we've had this call also is to try to disseminate the information to all the leaders so that we can actually enforce the social distancing. That's what's going to help us. Because, with the testing, like we've heard from doctor, that is not really, it doesn't help. You don't have to wait to get tested. First thing to do is to enforce the social distancing, and then quarantine yourself. If you have any symptoms or anything like that, even if you don't have any symptoms, I think we should let our community know that let's try to enforce the social distancing, because that's the only way we are going to try to eradicate this thing. Otherwise, because we've already heard, Clarkson is already hit, and with all the language barriers and all that kind of stuff. And the reason why we have all the communities, the Nepalese, the Somali, and all the communities in Clarkson, we want all the leaders to go out there and disseminate the information and actually enforce the social distancing and quarantine themselves. One thing is going to be challenging, of course, people have to work, and some companies are still, still having people go to work. But I think, if it comes to that, when you cannot really stay home and you have to pay bills and, take care of your family, trying to really protect yourself, coming back home and sanitizing, washing your hands, and trying to really protect yourself when it comes to that. Otherwise, we try to do the social distancing. That's what I can say about that. But if there's anybody out there who is being laid off, please let me know, because we're going to try to, see how best we can, provide some information to combat that. Thank you.
Yeah, so it's a good question, and I say 7 days for people that have mild symptoms that improve. there are people, even as young as 30 we've seen, that have developed more severe symptoms. And in that case, they do need to go to the hospital, especially if they're feeling very short of breath. For people that have mild symptoms, kind of like a common cold, like fever, cough, those people, we recommend right now just taking Tylenol. And we recommend just staying hydrated and taking lots of fluids. If they want, they can also take some Mucinex. But we are saying don't take any ibuprofen, Motrin, diclofenac, aspirin. Don't take any of those medicines. Just take Tylenol if you need to take like a fever reducer or pain reliever, because there's some evidence coming out from around the world that ibuprofen or Motrin can make things worse.
What can we do for right now to help distribute the information? Because I think you just have to hear it over and over and over and over again by more and more people. So what can we do to help get that done?
So this is Dr. Kim. I have written just like a one-page document of kind of key talking points for community leaders to tell kind of the people that they know. And I would be happy to send that out. It's just kind of a abridged version of a lot of different CDC guidelines and other guidelines, just so that they can say, and just so that they can tell people, you really need to do this, you really need to do that. This is really serious. We're going to see people die. Like, this is not something that's just going to pass away. But I do have a little document I've written, just a one-page document in English of just talking points, essentially.
Dr. Kim, this is Omar again. Thank you for clarifying about the Tylenol and ibuprofen. But also, I think I was hearing an expert on CNN saying some antibiotics might be working. Do you know anything about that?
Yeah. So another medical question, and so the medical treatments I think could potentially be helpful, and there's some that are promising. I think the biggest difference to the community is going to be getting the word out, social distancing, and it'll be much more important than any of the medicines. As a brief answer, though, to your question, one medicine that has been shown that's an old drug is called chloroquine, and there's another version called hydroxychloroquine that's available in the USA, also known as Plaquenil, and it's an anti-malarial drug, but also a drug used for rheumatoid arthritis and a few other diseases like lupus. And a combination of that drug with azithromycin, which is a common antibiotic, has been shown to be beneficial in some small studies throughout the world. And so I know at Emory Decatur they're using that protocol on some patients, but it would only be for patients that have to be hospitalized or patients with mild symptoms that have a lot of different risk factors. I would not recommend that for most people. And there's enough side effects where it's not worth the risk for people that have mild disease.
Let me throw something out there, and Prem, I don't know if you want to talk about this, but would it be helpful for us to make some recordings, some voice recordings or YouTube video recordings that you could put on your Facebook pages, that we could distribute through Sagal Radio, that we could put, any one of we could ask the CRSA agencies to put out there? Would that be something that you think would be helpful to get to people, is recorded messages?
Yes, of course. What we can do for the community is every community leaders, if you are available to record your language voice for your community, I would really happy to record your voice and to broadcast from the YouTube and our Sagal Radio platform. And the other thing is, this is another problem in the USA is most of the refugee communities and new immigrants communities, they have language problem. And if you are willing to record on your language, in your language, and then
you can spread your message to your community people, I would really help. Happy to record your voice and spread your message to your community.
That would be a very good idea. And also, if we can get the symbol page that Dr. Kim is talking, that we can, translate that and make it easier and put all the. Maybe we can have some in my office or Fatma's office and Sagal Radio and everywhere that refugees go, like refugee coffee everywhere. I know there are some, but still we need to do more.
Mm-hmm.
We just need to come together and do more about this and do whatever we can.
Yeah, I agree with you, Omar.
And like somebody said, we just have to keep talking about it and talking about it.
Yes.
Mm-hmm. Yes, that's right. Yeah. So, any of community leaders or members, you are willing to record your voice with your specialist doctor in your language, just let us know that we can record and spread the message to the community people. And so the other thing is, if you have any other ideas to spread the message to your community in your language, just let us know. We can record it and we can spread to your community.
Justin speaking. I just wanted to add on that. I think, we're going to have to really be very proactive and just take action. Because, just like Omar said, we can talk about it, but we need to take action. I think what we can do after this call is to reach back to all the community leaders and set up an appointment to record all the leaders, conveying the message so we can be able to at least send that out as soon as possible. Because, the time is not there to really wait. And I'm really happy that we've had this opportunity to have all the leaders to discuss this matter because, we need to take action. So I'm happy that all the leaders are willing to do this. And, we need to disseminate the information in all the various languages because we just like Prem, you say, all the community, we have language barriers. So we cannot convey this just in English. We need to break it down to all the different languages that are out there in the community. So I think next step is to follow back with an email to all the leaders and set an appointment, record each and everyone to convey the message. And I wanted to ask Dr. Kim, even if after we do this, do you think we can have you also do a recording?
Whatever you need. Yeah.
Mm-hmm.
Yeah, whatever you need, I would be happy to do. And I can change what I wrote to make it into a little bit of a script that I can then send over to Ms. Rubinson, and maybe you guys can then edit it a little bit to make it as clear as possible. I know I can sometimes write in too much medical terminology just to clarify it and simplify it, and then it can be disseminated as like a guiding script for people to put into their languages.
Yeah, wonderful. Okay.
That'd be helpful. Omar, again, I'm sorry. And we need to reach out those community leaders who could not make it today, who may be having to go to work or doing something, or because we need to reach every ethnic community.
That's right.
All right, well, let's put that out there. If we need to convene anything earlier, we can do that by email. And I think until then, we'll just communicate by email and share information. How does that sound?
Yep. Very good.
Good.
Thank you.
That's good.
Thanks, everybody. Thank you for participating.
Thank you very much for joining us this evening.
Thank you, Sagal Radio.
All right, thank you.
Thank you so much.
Thank you. Have a great